Assalamualaikum warahmatullahi wabarakatuh. Hello everyone.
We are from Group 2. Let us introduce ourselves. My name is Siti Sa'adah.
My name is Muliasari.
My name is Sephia Zandra.
My name is Zahra Bilqis Syahidah.
My name is Risma Putri. Happy working!
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. First of all, I respect Mrs. Zahra Muliasari as an English lecturer and also all my friends who I love and I'm proud of. Let me introduce myself. I'm Siti Sa'adah as the moderator who will help lead the group 2 presentation. The topic of our presentation today is public health policy. This is important because public health policy is related to health regulation that develop in the community. And this presentation will help you understand more about public health policy. Group 2 has 5 members. They are Siti Sa'adah, Sri Muliasari, Sephia Zandra, Risma Amelia Putri, and Zahra Bilqis Syahidah. The main points we will talking about are firstly, what is public health policy? Secondly, the importance of public health policy. Thirdly, the components of public health policy. Fourthly, the aspects of public health policy. Fifthly, how to develop a public health policy. Next, finally, the examples of public health policy. Let's start with what is public health policy.
I will tell you about definition of public health policy. Public health policy is defined as the laws, regulation, action, and decision implemented within society in order to promote wellness and ensure that specific health goals are met. Health policies are made by the government and the private sector. Public health policy plays a role in multiple sectors including healthcare, insurance, education, agriculture, business, and others.
Now, let's move on to the importance of public health policy.
The importance of public health policies is important because among which are creating action from research and finding broad solutions to previously identified problems. Public health policy is crucial because it's bringing the theory and research of public health into the practical world. Public health policy create action from research and find widespread solutions to previously identified problems. As a public health policy official, you are responsible for initiating strategies and policies around both health intervention and prevention. To allow your target population to flourish, you must address not only physical health, but mental, social, and economic well-being as well.
Next is the components of public health policy.
Components. Number 1. Elementary education. Elementary education aims to cultivate teachers who are professional, intellectual, and critical consumer and producer of educational policy, practice and research. These competencies include a commitment to critical thinking and research-based pedagogy. The elementary education program emphasizes learning as a human right and nurture creative, responsive, and reflective practitioners who challenge students to become global citizens in a diverse, ever-changing world. Number 2. Integrate rural development. Integrate village development is village development carried out by intensive effort with the aim and tendency to focus attention on certain groups and regions. Number 3. Population control. Human population planning is the practice of deliberately controlling the rate of human population growth. Number 4. Welfare of women and children. Protection of women and children, hereinafter abbreviated, is PPA, in an effort to protect and fulfill the right of women and children from all forms of violence, discrimination, special protection, and other problems.
Now, let's move on to the aspects of public health policy.
As far as aspect in public health policy, mainly number 1 is health education. Health education is an effort that is given in the form of guidance to the student about health, which includes all aspects of personal health, physical, mental, and social, so that their personality can grow and develop properly through curricular and extracurricular activity. And number 2, development of managerial information system or MIS. And number 3, production of drug and equipment. And number 4, health insurance and legislation. Health insurance will help provide for all medical expense, medicine, hospitalization of up to surgery. If at any time you fall ill, then the insurance company will cover the medical costs according to the contract of agreement. And number 5, medical research. Medical research, biomedical research, or experimental medicine is basic research, application research, or translational research conclude to support knowledge in the field of medicine. And last, policy formulation. Policy formulation is an effective and acceptable development to address what problems have been placed on the policy agenda. In the policy formulation, there are several things, namely, first, identifying policy needs, second, formulation policy, third, designing policy strategies, and last, reviewing the policy.
Next is how to develop a public health policy.
According to the CDC, Associate Director for Policy and Strategy, the organization uses a 5-part process for public health policy. First, problem identification. Public health problem and their root cause are clearly identified. This problem and these underlying cause are then described by public health professionals in a detailed report summarizing the impact on public and public health. And number 2, policy analysis. Once a problem and its root cause are identified, public health professionals can move on to analysis. During this phase, stakeholders review the problem and analyze our potential solution. To the problem through in the deep and systematic analysis process. The goal is to choose the most reasonable, efficient, and effective way to solve the problem.
3. Strategy and policy development. Next, public health officials work to create and formulate a policy which outlines the problems, its causes, and the ideal solution selected during the policy analysis step. Stakeholders also strategize on how best to enforce solution and ensure adoption among the public.
Number 4, enforcement of the policy. Once the outlaw draft public health policy has been developed, stakeholders can begin to obtain the necessary permits and approval to put the policy into effect. This may require authorization from organizations such as the WHO or the CDC, from other federal agencies, and realization or school district administration, depending on the type and purpose of public health policy.
5. Policy implementation. The last step in this process is implementation, where the policy is actively enacted in society. Public health professionals need to support implementation with additional efforts, including educating the public about policy details and monitoring enforcement. The CDC model for public health policy is similar to that used by other regulatory agencies around the world.
And the last is the examples of public health policy.
Example of public health policy. 1. Food safety policy. Food safety policies are very important to the general health of individuals and people in society. Food-related illnesses are a significant concern, and it is the job of public health officials to formulate policies to ensure that only food that is safe for consumption is made available for the public. 2. Tobacco use. Many public health officials have put measures in place to reduce the risk of deaths and illnesses caused by tobacco consumption and smoking. Some of these policies include increasing tobacco prices and creating tobacco-free areas in communities to protect non-smokers from the effects of secondary smoking. 3. HIV. Public health policy plays an important role in educating the public about HIV prevention, how to live with the virus, treatment options, and preventing stigma. Public health policies, including increasing access to testing, birth control, and medicine, have been implemented to drastically reduce the impact and spread of the virus in various communities. 4. Alcohol. Alcohol abuse is one of the leading causes of vehicular accidents, violence, sexual assault, health complications, and more. Public health policies are crucial in the fight to curtail alcohol dependence and reduce its negative effect on users. Policies on alcohol differ depending on the community, but the most common example is age restriction in the consumption and purchase of alcohol.
Thanks to my friends for the presentation. I'd like to recap the main points of our presentation. First, I covered public health policy is defined as the laws, regulations, actions and decisions implemented within society in order to promote wellness and ensure that specific health goals are met. Public policy is very important because it regulates various regulations in public health. Public health policy also has various components, aspects, and ways to develop it. And finally, one example of a public health policy is food safety policy. I'm going to conclude by saying that public health policy plays a very important role in creating good quality in public health. That's all from us. Thanks to Mrs. Ratu and audience for your attentions. We apologize if there are any mistakes.
And see you next time.
Wassalamualaikum warahmatullahi wabarakatuh. Bye.